Okay, so let's talk about some issues that happen when people start thinking about around the time of surgery. First of all, just to get to surgery, just like any operation, we want to do our homework. We want to have preoperative evaluation and preparation. Now sometimes when people have emergency operations, obviously, in the hospital, this has to be pretty quick. But for an elective operation, like any weight loss operation is, or any diabetic operation, we have plenty of time to work on this. First of all, to find problems, and then second of all, to manage them, to try to get them stabilized. Certainly we want to be very complete in terms of knowing your individual risks so that we can manage them, and that includes, for everybody, preserving protein but getting the weight managed so that that's as optimized as it can be prior to surgery as well. Now some programs used to do this by setting a certain pound number that you had to be at before surgery and canceling your operation if it didn't work. That can invite some problems with abuse in terms of people using laxatives or starving their weight off or sweating their weight off, and they would show up potentially at surgery dehydrated or with screwed up electrolytes with low potassium or with other problems. So we don't do that necessarily anymore. What we do instead is focus on getting people to try to shrink their liver, shrink their intra-abdominal fat, and we do that through a preoperative liquid diet, usually for 2 to 4 weeks. And it sounds hard, but it's not that hard to do. And again, what we want to do is make sure that there's weight out of the middle of the abdomen so that laparoscopy is its very easiest, and even if we have to do an open surgery, so that we have plenty of ability to do that as safely as possible, while preserving protein so that your immune system works well and your healing works well. So those are very important things before surgery, and this is just a couple of lines that's really quite complex in some people in terms of getting them best prepared for surgery. My own doc, when I had surgery, I was not a very sick guy, but I had high blood pressure and it was not very well controlled, and he said, "Walt, I want this under control for more than 2 months before you have surgery. Your stroke risk doesn't go down until your blood pressure has been under control for a couple of months." I had my date set. I was under reasonable control, but not optimal control. I changed my vacation time that I had time off. I changed my surgical date, moved it back by 3 months, and I was even paying out of pocket. And this is why I tell people be very patient for this process, because we do want to take the time to make it as safe as possible. Now that being said, we don't want to delay you once you've made a decision and once you're ready, but safety first, and we will work with you to help you on this. Now secondly, at surgery and around the time of surgery, you are in the hospital between 1 and 3 nights for laparoscopic surgery. With certain procedures with lap bands, people will go, adjustable gastric bands, people will go home the same day. Sometimes with application they will. The principle that's important is whenever you go home from any operation, your pain is well controlled, you have good fluid intake. It may not be perfect, but that nausea is well enough controlled that you can get enough fluid down that you don't need to have IVs to supplement. You need to be able to walk, first of all, just so you can get around when you're at home, or if you're coming from farther away, staying in a hotel here in town for 3 to 14 days after surgery. You need to be able to walk also to prevent clots and to stand up so you can take a deep breath so you can prevent pneumonia. This deep breathing and walking is important, again, to modify your risk. It's not just, pain control is not just for comfort. Pain control really helps you do these things to minimize that risk. And you remember I said earlier how important it is for us to minimize the risk of clots and pneumonia. So everything is very individualized, like I said before, but for the most part, for most laparoscopic procedures, people are in the hospital or sometimes in the outpatient surgery center for 23 to 72 hours. Sometimes we can send people home the same day, but we don't push for that. Certainly for gastric bypass, you can expect to stay at least overnight, on average 36 to 48 hours. if we have to make an open incision, you will be in the hospital on average for 3 to 7 days. It just takes a little longer to get that pain under control from a bigger incision. And we can keep it under control in the hospital, but you can't go home on just pain pills post-op day 1 or 2 usually from a big open incision. It takes a little longer. Once you get home, you're doing just as well. 30 days later, you hardly can tell the difference between somebody who's had an open or laparoscopic procedure. But certainly those first few days are different. We do an upper GI X-ray study on many patients, not necessarily everybody, but to look for leaks and to define that anatomy. In terms of re-advancing your diet, getting you back on food, for the first couple of weeks after surgery, you're on a liquid diet so that things can heal into place. The liquid also is just easier to swallow, so you're not as cautious about doing that. And the most important thing actually is getting the fluid on board. This hydration is very important. You can go a week or 2 on lower protein, especially if you're built up before surgery, if you're fully replete. So the main job is getting enough fluid in and avoiding problems with pneumonia and blood clots. And pain control as well. So that's early issues both in the hospital and home, and we'll help you get ready for that. We have information to hand out on that specifically around the time of surgery, and you'll get specific education at the time of surgery for that as well. In terms of limitations for activity, like any operation, whether it's your gallbladder or appendix, for laparoscopic surgery, it's between 2 and 4 weeks coming back to most activities. I tell people for competitive athletics or professional athletics, something where it's super high intensity or competitive weightlifting, you probably want to wait about 3 months if you can help it before you really have to do something to that 100% level. Very high impact things like kickboxing or jumping a snowboard or a mountain bike, you want to give that a couple of months. But most people can be back in the gym or walking or even jogging within 1 to 4 weeks. The jogging I'd probably wait a few weeks, but I was back at the gym doing a light treadmill and light weights within a week after my surgery, and it was not terrible. We don't worry so much about people popping things open like we used to. I've never actually seen anybody specifically tear anything open. It certainly hurts, and we don't want you to go out and try to go back to work. If your job is unloading trucks for a living, you're not going to be able to do that in terms of work. That's going to be more like 3, 4, 5 weeks in terms of all-day heavy lifting. Most people don't do that these days, and in terms of being at a desk, you can be at your desk within a week. However, fatigue is not going to allow you to do your job as well. So it is good not to tell people that you're going to be back at work full-time a week out from surgery. You're going to be half days or every other days. You're not going to be doing your very best. There's going to be a harder time concentrating, and you're going to be tired. You're going to need to spend time with your feet up and relaxing and recovering. But if you have to be at work, you certainly can, for most jobs, be back on the work site within a week to 2 weeks after surgery. The most important thing about returning to work is for those folks who drive to work, that when you drive home, you are going to be maximally fatigued. And I really worry about people in the car. That is heavy machinery, and if you run over somebody on the way home, if you cause an accident or a crash, and you look back and say, boy, I was fatigued, I was not at my best, that's going to be a real problem. So the sooner you go back to work, the more I want you to be half days or every other day, but particularly the more I want somebody to drive you home. And be careful even driving to work if you don't have your rest. Now, for a lot of working moms especially, where you have as much work at home as you do at work, you're going to have to pick your priorities. It is going to be hard that first few months to get everything done. And so start very carefully, lower your family's expectations maybe of how much you're going to be doing to support them, or lower work's expectations about how much you're going to be able to do, because you just only have so much energy, and it really is for most people 3 months before their energy is at 100%. They may be great for 3 or 4 hours, but boy, if they go out and try to do a full day's work and then a full home work as well, they just run out of juice. And so just try to pick the priorities and do them first, and don't have a super high expectation of how quickly, even though you'll feel, like I say, for most people they feel 100% within a month for a lot of the time, but just not the energy, not the durability until they get a few months.